The year was 1918, a year that would be etched into the annals of history for more reasons than one. The world was engulfed in the flames of the First World War. Nations clashed in a brutal conflict that spanned continents, leaving devastation in its wake. Yet, amidst the chaos of war, a different enemy was silently emerging. An enemy that did not wear a uniform or carry a weapon. This enemy was not confined to trenches or battlefields. It moved invisibly through the air, striking down soldiers and civilians alike. It was a virus, an influenza virus, destined to become known as the Spanish flu. This virus would spread with a ferocity that the world had never seen before. This pandemic would claim millions of lives, leaving a scar on the world just as deep as the war itself. Families were torn apart, communities devastated. The world was largely unaware of the impending crisis. People went about their daily lives oblivious to the silent killer that lurked among them. Medical science was still in its infancy compared to today. Hospitals were ill-equipped to handle the sheer number of patients. Antibiotics were yet to be discovered. The medical community was at a loss, struggling to find ways to combat this new and deadly threat. The ability to combat such a threat was limited. Doctors and nurses worked tirelessly, often falling victim to the very disease they were trying to treat. Little did the world know, it was on the verge of facing one of the deadliest pandemics in human history. A pandemic that would change the course of history and leave an indelible mark on humanity. The virus responsible was the H1N1 influenza virus. It spread with terrifying speed across the globe. This was a world at war, and troop movements unwittingly aided the virus's journey. 3 distinct waves characterized the pandemic. The first wave appeared in the spring of 1918, relatively mild in comparison to what was to come. The fall of 1918 saw the arrival of the second wave. This was the deadliest period of the pandemic. The virus had mutated, becoming more lethal. Hospitals overflowed with the sick and dying. Mass graves became a grim necessity in many cities. The death toll was staggering. Estimates suggest over 50 million people worldwide succumbed to the virus. In the United States alone, 675,000 lives were lost. The impact, however, extended far beyond mere numbers. The Spanish flu did not discriminate, but it disproportionately affected young adults aged 20 to 40. This demographic represented the workforce, the backbone of society. The loss of so many young lives had profound social and economic repercussions. Businesses struggled to operate, essential services were stretched to their breaking point. The world was grappling with a crisis that touched every aspect of life. A century later, the world found itself facing another pandemic, COVID-19. While the viruses were different, the echoes of 1918 resonated strongly. Once again, the world witnessed the rapid global spread of a respiratory virus, overwhelming healthcare systems and causing widespread societal disruption. The fear, uncertainty, and loss experienced during COVID-19 were hauntingly familiar to those who studied the 1918 pandemic. The parallels were undeniable. Both pandemics highlighted the interconnectedness of our world and the vulnerability of even the most advanced societies to infectious diseases. Section 5. The Advance of Science, a Century of Progress. Over the past 100 years, the field of medical science has seen extraordinary advancements. From the rudimentary laboratories of the early 20th century to the sophisticated research facilities of today, the journey has been nothing short of remarkable. Yet the COVID-19 pandemic also underscored the remarkable advancements in medical science and technology over the past century. It highlighted both our progress and the challenges that remain. The rapid response to the pandemic, including the development of vaccines and treatments, showcased the incredible capabilities of modern science. In 1918, during the Spanish flu pandemic, there were no vaccines or antiviral treatments for influenza. The medical community was largely unprepared for such a widespread health crisis. Hospitals were overwhelmed, and the lack of effective treatments led to a high mortality rate. Doctors and nurses relied on basic public health measures such as isolation and quarantine. These measures, while crucial, were not enough to prevent the massive loss of life. The experience of the 1918 pandemic underscored the need for better medical interventions and public health strategies. Fast forward to the COVID-19 pandemic, and the world witnessed the rapid development and deployment of effective vaccines. Within a year, multiple vaccines were developed, tested, and distributed on a global scale. This unprecedented achievement was a testament to decades of scientific research and collaboration. Antiviral drugs, while not a cure, offered treatment options that simply didn't exist in 1918. These drugs helped to reduce the severity of the illness and improve patient outcomes. The availability of such treatments marked a significant advancement in our ability to manage viral outbreaks. These advancements undoubtedly saved countless lives and mitigated the severity of the pandemic. The progress made over the past century in medical science and technology has been extraordinary, and it continues to shape our response to health crises. As we look to the future, the lessons learned from past pandemics will guide us in our ongoing quest to improve global health. Section 6. The Unlearned Lessons, Echoes of Neglect. Despite the progress made, the COVID-19 pandemic also exposed uncomfortable truths about the world's preparedness for such events. Chronic underfunding of public health infrastructure, inadequate surge capacity in hospitals, and the spread of misinformation hampered the response in many countries. These shortcomings highlighted a failure to fully learn the lessons of 1918. The Spanish flu pandemic had demonstrated the importance of robust public health systems, international cooperation, and clear, consistent communication. Yet, in many ways, the world was caught unprepared when COVID-19 struck. Section 7. The fragile frontline healthcare systems under strain. Both the 1918 and COVID-19 pandemics placed immense strain on healthcare systems around the world. Hospitals and healthcare workers faced unprecedented demands for care, often working long hours with limited resources. The mental and physical toll on these frontline heroes was immense. These pandemics served as stark reminders of the essential role healthcare workers play in safeguarding public health. They also highlighted the need for continued investment in healthcare infrastructure, training, and support for healthcare professionals. Section 8. Navigating Uncertainty. The Importance of Public Trust. In times of crisis, clear communication and public trust are paramount. Both the 1918 and COVID-19 pandemics were marked by periods of uncertainty and fear. In 1918, wartime censorship often hindered the free flow of information. During COVID-19, the rapid spread of misinformation online posed new challenges. Building and maintaining public trust requires transparency, empathy, and consistent messaging from government officials and public health authorities. When trust erodes, it can undermine public health efforts and exacerbate the impact of a pandemic. Section 9. The Enduring Legacy Preparing for the Future. The Spanish flu pandemic of 1918 may be a distant memory, but its lessons remain as relevant as ever. This devastating event claimed millions of lives worldwide and left an indelible mark on history. It taught us the importance of rapid response, public health measures, and the need for global cooperation in the face of a health crisis. Infectious diseases have the power to disrupt our lives and test the very fabric of our societies. They can bring economies to a standstill, overwhelm healthcare systems, and create widespread fear and uncertainty. The Spanish flu was a stark example of how unpreparedness can lead to catastrophic consequences. The COVID-19 pandemic served as a stark reminder of this reality. It showed us that despite advances in medicine and technology, we are still vulnerable to new and emerging infectious diseases. The global impact of COVID-19 was unprecedented, affecting every aspect of our lives and highlighting the need for better preparedness. As we move forward, it is imperative that we prioritize pandemic preparedness. This means not only having the necessary medical supplies and infrastructure in place, but also ensuring that our public health systems are robust and resilient. We must invest in research and development to stay ahead of potential threats. This includes investing in public health infrastructure, strengthening global health security, and fostering international collaboration. By working together, countries can share resources, knowledge, and expertise to combat infectious diseases more effectively. Global health organizations play a crucial role in coordinating these efforts and ensuring that no country is left behind. It also requires each of us to embrace a sense of shared responsibility for our collective well-being. Public health is not just the responsibility of governments and organizations, it is something that we all must take part in. By staying informed, following public health guidelines, and supporting community health initiatives, we can all contribute to a healthier future. By learning from the past and preparing for the future, we can better protect ourselves and future generations from the threat of pandemics. The lessons of the Spanish flu and COVID-19 remind us that vigilance, preparedness, and cooperation are key to safeguarding our health and well-being. Together, we can build a more resilient world, ready to face any health challenge that comes our way.